Welcome to the Denneroll User Guide, an information video. In this video, I will be discussing with you some of the reasons for using the Denneroll and also how to apply it in the clinic and at home. The Denneroll is effective in combating against the stresses that forward head carriage places on your body. The increased prevalence of forward head carriage is mostly attributed to the postural challenges of today's lifestyle. The effects of forward head carriage on the body causes increased muscle and ligament tension to the neck and upper back. This increased tension commonly contributes to neck and back pain and also headaches. What we are seeing is that prolonged forward head carriage causes detrimental effects to the body. Progressive poor posture associated with forward head carriage is linked to health disorders such as neck pain, arm pain, headaches, organ dysfunction, and further studies are now showing that it contributes to depress your mood and even shorten your lifespan. This is due to the effects on your spine and nervous system. Over time, this causes the skeleton of your body to deform away from its ideal position. Loss of curve is the first stage in degenerative arthritis and disc disease in your neck. Unattended, this loss of neck curve is synonymous with the further degradation of your cervical spine and nervous system. Using the Denneroll provides a passive and effective stretch towards a healthy neck curve. It can reduce muscle and ligament tension caused by forward head carriage. Studies are now showing that regular use of the Denneroll assists towards the restoration of a healthy spinal curve. By doing so, you dramatically reduce the likelihood of recurrent symptoms. This easy-to-use product can be safely used at home and is small enough to take with you when you travel. Applying the Denneroll is simple. There are two sizes, a small and a large, and you need to decide which size best suits your patient. The Denneroll should first be used in clinic under supervision. The practitioner should support and guide the patient's head during initial traction. Increased pain or symptoms indicates the patient is currently unsuitable for use. The application may be revisited at a later stage of their care. Starting with the small size Denneroll, if the patient's head touches the ground firmly, then the larger size is most suitable. The patient is then instructed to straighten their legs, as this increases the stretch. When using the Denneroll, you must lay on a flat, firm surface. During traction, it is important to relax. The more you relax, the greater effect it will have on your muscles and your spine. The Denneroll can be placed further down your neck for greater comfort or stretch. Tolerable discomfort does not indicate the patient is unsuitable for use. A patient may begin traction sessions between 1 and 3 minutes and then progress in length of time. 10 to 15 minute sessions are recommended. However, more flexible patients may require traction up to 20 minutes. The lower the placement of the Denneroll, the more effective it will be against the effects of forward head carriage. Upon finishing your traction time, it is best to bend one knee and roll sideways without lifting your head. The Denneroll can then be safely removed, and you then return to laying for at least 10 seconds before rising. Looking at the functional effect of the Denneroll on the spine, as this patient lays flat, X-ray shows the same decrease in neck curve as when they were standing. As the patient lays on the Denneroll, in traction X-ray, shown here, reveals an effective stretch on the spine in the direction of a healthy curve. The Denneroll is a simple, safe stretch in the right direction. The more consistent the use, the greater effect you will have towards change. Daily use is recommended for postural and structural improvement. We thank you and applaud you for your efforts towards optimal spinal healthcare.